So I'll be speaking on, the CCC conundrum in SICS. This is, as we all know, is the slides visible?
Yes, sir, very much visible.
Okay, fine. The discussion point here is that there's no doubt that Rexus has been the greatest innovation in the cataract surgery for the last 20, 30 years. So there's no doubt about it. But in SICS, it's a little bit of an issue because especially we understand there are two main obstacles for nucleus management in small incision cataract surgery. One is obviously the Rexus size and second is the width of the scleral tunnel. So I'll be speaking on the Rexus, importance of the Rexus and how zonular stress is exerted during nuclear manipulation out of the capsular bag. So that's the issue which you are worried about. And so for beginners, what are the options we have? Of course, scan opener is the classical technique for these things, but we cannot recommend this now in this era where Rexus is the norm simply because of its safety concerns. So we always believe that CCC still is the way to go, even in SICS. The only secret here, you need to do it bigger, especially when you are in your early part of your career. So it's always going to be easy to prolapse the nucleus of the bag, and we're going to have less of an issues as far as the complications regarding the zonular kingdom. But there are certain issues with bigger Rexus. Now, this is an eye with a PMMA lens and a very large Rexus, or maybe some other form. We are not able to see the Rexus size. So what are the consequences of this is, after 2-3 years, the bag starts to contract. We have fibrosis, and you can see there is a slight decentration of the lens. What it eventually leads down is to the refractive instability. This is another case. After 2 years, we have got a very large Rexus. You can see the margin is somewhere here. The lens is displaced out. This is a soft lens. And we can see, of course, the PCO is there and a lot of fibrosis. Ultimately, what it eventually leads is we want to have a situation like this where 360 degrees of the optic is captured or covered by the Rexus margin. Otherwise, we're going to have, this is the goal to achieve, simply because it ensures long-term centration and refractive stability. Of course, PCO control is multifactorial and it's debatable, but at least for a refractive stability, we want to ensure that the Rexus is always round and covering the lens margin always. Of course, we have the advantage of using the safety net of the Rexus when the PC tear happens, as in this case, where we can achieve a perfect optic capture and still have excellent outcomes. So what are the, how do we go about this? Like, how do we enhance our skills so that we can manage to remove the Rexus even in manage the nucleus out even in a small Rexus? I think the trick here is to master the bimanual technique of nucleus prolapse. So what I'm trying to do here is just want to demonstrate this. Of course, after doing hydrodissection, you're using 2 Sinskey hooks just to push the nucleus down and maneuver it out. It's calling the wheeling technique, wherein you ensure that even in spite of a smaller Rexus, the nucleus can still be managed out. A Rexus is about 5 to 6 millimeter, and you can see the nucleus is quite bulky. The nucleus is tipped down, pushed down, and then one hooks the equator of the nucleus, and the second instrument just wheels the nucleus out of the bag. So if one can master this technique of bimanual prolapsing out of the nucleus, you're using 2 Sinskey hooks. See, this is a Rexus which is about 5.5 millimeter, and you have a nucleus which is about 8 millimeter. In spite of that, you can still see that if you are able to wheel the nucleus out using these 2 techniques, just engage one equator of the nucleus and then wheel it out. You can see that you can remove prolapse with such a large nucleus as well out of the bag in a relatively smaller Rexus. So my take-home message with my presentation here is, you can start off with a bigger Rexus in an early learning curve, but eventually our goal is to ensure that we master the skill of prolapsing the nucleus out of the bag using this 2-handed technique. By this technique, we can remove a bulky nucleus, even of a smaller Rexus and a smaller pupil as well. So in initial part, you can very well do with a bigger Rexus size, but as you get experience, I think you need to concentrate on bringing the size of the Rexus down so that eventually, we achieve the goal of better refractive stability over a period of time. So in early part of the career, you take simple cases like this, you confirm you do hydrodissection and ensure that the nucleus is freely mobile. And these are such cases not easy to begin with, wherein you ensure that it is free from it and you have a slightly bigger rhexis. And using 2 Sinskey hooks, just learn this technique. I think this was my tip for the beginner. These are softer nucleuses that are very easy to prolapse out. So once you have achieved this, you can then graduate to bigger, harder nucleus. With that, I would like to conclude my presentation. I would like to thank the organizers for the opportunity. Thank you.